You probably just got your MRI results and you found out that you have a herniated disc or a bulging disc, and you're wondering, what the heck do I got to do? Do I need to get surgery? Can this heal on its own? What should I do? In this video, we're going to answer all those questions and hopefully bring you some peace of mind. Hi, I'm Dr. Daniel Bridge, and I'm a chiropractor in Endurance Chiropractic in Helena, Montana. This channel is dedicated to helping you with your overall health, helping you to live your best life. Can you heal from a herniated disc? The short answer is yes, and most people will. But that doesn't answer all your questions, does it? So let's go through a commonly asked question and answer session and see if we can help you to navigate through these next steps. Question number one, how long does it take for a herniated disc to heal? A lot of people are going to heal within that first 3 weeks, and according to Harvard, 90% of people within 6 months are going to no longer be having those symptoms of a herniated disc. What are those symptoms? You can have pain in the back, you can have pain there in the buttock, and with that nerve pain, you can irritate that sciatic nerve, which goes down the back of your leg. So you might have a burning pain, numbness, tingling or weakness down the back of your leg, all the way down to your ankle, and sometimes even to the bottom of your foot and your toes. So, when should you see someone about this? When should you see your chiropractor? Well, the sooner the better. The sooner that we are able to get after that and diagnose that, we're able to set up a treatment plan for you, which can help you conservatively take care of this. You might be having the question, when should I see my chiropractor versus when should I see my medical doctor? A good chiropractor who works on herniated discs and sciatica is going to know when to refer you out to your medical doctor or to a surgeon. But I'll tell you right now, the main things that you really want to be looking for is something that we call cauda equina syndrome. That's if you're having any bowel or bladder dysfunction, meaning you don't have control of your bowel or your bladder, or you're having sexual dysfunction, or you're having numbness here in the pelvic region. That's really a red flag. That's when you want to go to the emergency room. That might be a surgical issue, and they usually have a small window to take care of that. So if you're having any of those red flags, be sure to get into the emergency room as soon as possible. The other time you know it's really time to see a surgeon is if you've been through conservative care and you've been through with somebody, a chiropractor or a physical therapist, and they really know what they're doing, and you're not getting any better after weeks, months, or the symptoms are even getting worse. That's when it's a really good idea to talk with somebody about doing something more invasive. But this video is really about those people who aren't those extreme cases that are actually going to be able to take care of this conservatively. The next question is, can this heal completely, or will it always be something that is going to be bothering me? So the answer to this question is, did you see professional care to really help somebody heal this disc? In my office, one of the things that we specialize in is spinal decompression therapy, which is the best thing that you can do for a disc. A herniated disc is going to be, it's when that disc material is pushing out and it's pressing on a nerve because you have so much pressure on that disc. And what decompression therapy does is it helps to stretch that area and to reduce the pressure inside that disc. It can even bring in a disc herniation or a disc bulge, and it can help with the fluid exchange in the disc to help that disc to heal. That in and of itself isn't going to be enough for a permanent solution because you still need to stabilize that core and you need to have good mechanics in your lower back, but healing the disc is first and foremost. After that, once you get really good core strength and you have good movement patterns, this can be something that is taken care of, and it's not something that bothers you for the rest of your life, and you can lead a very normal life. So you got your MRI report, you're reading it, you're seeing things like protrusion, extrusion, disc bulge, disc herniation, prolapsed disc, and you're trying to make sense of this. Let's try to break down some of this and tell you what that means. People will oftentimes say, hey, I have a slipped disc. Discs don't actually slip in and out. It's just a term that people use for a herniated disc or a bulging disc, which also is not the same thing. So a disc is very similar to a jelly donut, at least in our intents and purposes. So you have the donut part on the outside, and then on the inside you have that jelly. Likewise, you have your disc, which has a firm cartilage on the outside called the annulus, and then the jelly on the inside is called the nucleus pulposus. And when you have a strong force or injury to that disc, it puts so much pressure into it, there's nowhere for that jelly to go, so it pushes out, and it can cause that firmer cartilage to balloon out, which would be considered a disc bulge. Or if it's so strong and it's weakened that cartilage over time, it can actually push through. And that's when you get that disc herniation, or another word for that is a prolapsed disc. The next question we're going over is, can I exercise with a herniated disc? That's kind of a two-part question. If your disc is really flared up, if your leg is really bothering you, you need to limit your exercises to something that has been prescribed from your chiropractor or your physical therapist. The last thing you want to do is just lay on the couch or lay in your bed and have bed rest, because that's going to cause your muscles to get weak and to shrink and destabilize that area, and it's going to be a lot easier to injure a disc again. So you do want to be active. Talk to your chiropractor or your physical therapist for specific exercises that you can do while you're still having a lot of that pain either in your back or your leg. That being said, as that disc heals and you're no longer having those symptoms, you can really lead an active lifestyle. There's things that you really want to avoid, and that's exercises, activities that cause a lot of bending at the waist. And if you're working, especially what you want to avoid is bending and twisting. So let's say you're working at a hardware store. You don't want to be picking up heavy things with poor lifting mechanics and twisting. So avoid that sort of thing. But once you have gotten past those acute symptoms, things like planks are really effective to build up a strong core. Planks on the side, planks in front. And see my channel and go through some of the other videos to find specific exercises you can do to stabilize that area. Once that's done, things like basketball, running, cycling, assuming that you start slow and they're not causing a flare-up of your symptoms, those could be really great activities to keep you active, to keep you moving, and to really keep you healthy. Should I take anti-inflammatories if I'm having a herniated disc? When you have a herniated disc, you're going to have a lot of inflammation in that area with accompanying pain. An anti-inflammatory like ibuprofen, Advil, aspirin, those can help to bring that inflammation down, and they can help with the pain. You really just want to be careful with long-term exposure to those, because as you know, they can be hard on your body and they can cause other problems. So the less time that you can have on those, the better. But initially, if you're in a lot of pain, they can help with the pain. In summary, yes, you can heal from a herniated disc. Your body is a self-healing machine. Usually it's going to take care of it on its own within 3 weeks, and if not 3 weeks, within 6 months. You shouldn't have to suffer for that whole 6 months, so make sure you talk to your chiropractor. Spinal decompression therapy can be an effective treatment for a disc herniation. There's exercises that you can do on your own that are safe and effective to help bring down that pain in your disc, the sciatic nerve pain, to help bring that down as well, and to help to stabilize that core so that this doesn't have to be a problem plaguing you for the rest of your life. With proper support in that area, you can live a very normal life, you can exercise, you can be active, and you don't have to always have this be a thing that's going to be plaguing you. Thanks for watching this video. Make sure to subscribe to our channel and like this video so that you can see more of our content in the future.